Hello, this is Dr. Mark Rohde. I'm a psychologist who enjoys working with recovery issues. Today I'm focused on the challenges that many young people have with becoming independent. We've known for a long time that young people in recovery have more than their fair share of difficulties achieving a complete and lasting independence. And we've often attributed these challenges to limited neurological maturity that seems to happen when brains are saturated with the effects of drugs and alcohol during critical periods of neurological development. The truth is, it's a bit more complicated than this. Many of us have noted a huge surge with this failure to launch syndrome during the economic downturn of 2008. But despite the country's gradual economic stabilization, the picture for many 20-somethings and some in their 30s who are in recovery, it's been pretty awful. The answer to the problem is really complex. Today I'm feeling rather hopeful that a team of researchers and clinicians at Columbia University have been developing a sophisticated understanding of 13 very specific skills that typically need to be acquired to become a well-adjusted adult. The psychologists at Columbia have also been working towards finding the most efficient methods for attaining this skill set. The program at Columbia is called LEAP, which is an acronym for their Launching Emerging Adults program. Now you could move to New York City and participate at their clinic. They're open Monday through Friday, 9 a.m. to 7 p.m., but I think that's probably not happening. So, over the coming weeks, I'll be using these podcasts to share some of the tasks that you want to tackle to become the most independent and autonomous person that you can be. If you're like most young people, you value independence a great deal. So I'm expecting that you're probably incredibly motivated to take these ideas seriously. Now here's a huge paradox. Your work towards independence is apt to be most effective if you work with a strong support system. And hopefully that system includes members of your family, a sponsor, and a highly skilled psychologist, counselor, or family therapist. Okay, skill number 1. Establish emotional independence from your parents. This does not mean that you ought to simply stop talking to them. It means you're going to want to work towards establishing a relationship with healthy boundaries. It means you'll want to have your ideas respected by them, and you'll need to accept them, even when their beliefs may be different than yours. You'll want to learn to accept your own feelings and reactions, and find healthy ways to express yourself with an ever-growing network of people with whom you've got mutually rewarding bonds. You probably need to grow your friend group, and that may take some assistance with learning how to do that best. A good part of the recovery process involves getting past your past, perhaps with mom and dad, little sisters, and big brothers, perhaps getting past difficult experiences, family moves, divorces, breakups, or worse. A key part of emotional independence is having a capacity for emotional regulation. Yeah, understanding and controlling your feelings. A psychologist or other experienced clinician can help you with techniques like cognitive behavior therapy, family systems counseling, mindfulness training, meditation, or perhaps just venting a lot of those uncomfortable frustrations. It's ideal if members of your family can participate in the process, but you can make progress regardless of their willingness to engage in this work. Ultimately, the goal is to become fully able to cope with a wide range of emotions when you have to deal with some challenges, disappointment, or a difficult memory. You'll want to seek advice when it's useful, weigh your options, and make informed choices. A good deal of self-acceptance would be nice too. Stay tuned. There's more to come.